centers that provides gender affirming services, kasi alam naman natin dito sa Pilipinas, kaming mga trans people ay hirap na makapaghanap ng mga centers or clinic that provides consultation, especially for gender affirming interventions, diba? So we provide that in our centers for free. And aside from that, we also provide HIV services, gender affirming HIV services through our centers, and also outreach activities conducted by Victoria and Lily by Love Yourself. Aside from that, in Trans and by Love Yourself, we also conduct researches kasi alam naman natin, di ba, lahat dapat ng programa at advocacy natin ay data-driven. So we currently have 2 researches on board in Trans and by Love Yourself, and hopefully more to come. And also in partnership with Ms. Tony and with other trans advocates as well. Yan lang.
So, Albion?
Nakakatuwa, Ms. Clea, to really feel that we have protectors in the community. Not just protect us, but they also uphold our welfare and for us to flourish with our lives. Although now I would like to ask or go on to more on your constituency, more on those communities we are protecting talaga. Ano naman community pagdating sa Sige, balik na naman tayo. Let's start with Ms. Yan. Ms. Yan?
Thanks, baby Albion. So in terms of challenges, especially now in pandemic, one, nawalan na tayo ng access dahil sa mobility issues natin and restriction. Nahirapang pumunta sa ating mga centers for HIV testing or treatment. Pero together with other advocates as well and centers, thankfully nakahanap tayo ng mga solusyon para paano ma-address itong mga ganitong problema. Sa ating mga trans community, during the pandemic, ang daming nawalan ng employment. Still, ang dami pa ring issues in terms of discrimination, human rights violations sa ating mga kapatid na mga trans, especially sa ating mga trans na person living with HIV. Meron tayong mga nakuha na cases wherein tinanggal sa trabaho nung pandemic dahil nalaman sa medical records niya that she is a person living with HIV and was not given due process. So nakakalungkot na even up until now, kahit may mga awareness campaign pa rin na tayong mga ganito, we the community, the trans community still experience these types of violations.
Great. Gosh, okay, yeah. Kahit may HIV AIDS law, diba? Parang nangyayari yan. Thank you. What about, if you can go to to Tony, ano yung mga challenges?
Yeah. Sinabi kanina yan kanina, no? Yung pag-access ng mga commodities, especially ngayon, pandemic, no? Nahihirapan because of the quarantine classification. And nahihirapan yung mga LGBTQ plus sisters and brothers natin sa community na ma-access yun because first, wala silang mga Q-pass. Second, yeah, limited yung movement kasi restricted yung movement. And lastly, yung social stigma. When we talk about HIV, nakaangka siya pa rin sa LGBTQI+. That's why marami tayong nakikita mga reported cases na sinasaktan na lang ating mga kapatid sa community is because for being an LGBT, kasi nga parang nakaangkla na yun ng HIV. And as an advocate, dapat natin i-challenge yun. No? We have to correct that kind of thinking, no? That HIV, hindi siya marunong mag-discriminate. As long as meron kang sexual risky behavior, mapabata, matanda, lalaki, babae, pwede kang magkaroon ng HIV. Yan lang. So, hindi choosy si HIV at hindi siya marunong mag-discriminate tulad ng iba dyan. Karoon, my God.
True. Tulad ng iba dyan. Thank you, Tony. And what about Mr. Ivan?
Yes, for Batangas naman, ang unang naging challenge pa rin, same with Yan and Tony, is yung pagkaputol ng communication or pagkaputol nung nalimitahan yung services ng HIV and other services dito sa Batangas. And ang pinaka nakita namin is talagang yung ARV delivery. Kumbaga salamat na lang din at may program na may mga sumusuporta like yung Global Fund, PSFI, TLY. Kung ang nakikita ko, paano kaya kung wala? So, ang isang challenge ng programa, kumbaga tuloy-tuloy na org development, pagka-capacitate sa mga community-led organization na pag-alis, hindi, nakikita naman natin hindi lifetime na nandito yung ganitong mga funding at grants. So sila na yun, kami ng community ang magtutuloy ng nung nasimulan na interventions. Tapos yung isa pa ay kung may HIV ordinance na-amend at naging compliance RA 11166 yung Batangas, ang nakikita namin dito ay may kapatid siya na ordinansa which is yun yung anti-discrimination ordinance na mas mahihikayat siguro yung ating mga key populations na i-access yung mga services kung ramdam nila na safe at comfortable, walang mag-judge sa kanila, ano man yung gender, ano man yung expression nila. So yun, yun yung nakikita pa namin. And last is community center na pwedeng puntahan yung ating mga key populations na pwede nilang i-access yung iba't ibang services. Pero sa ngayon, sinisimulan na namin yung dialogue at yung pakikipag-usap sa pwedeng makatulong sa Wagayway Equality. So far, yun yung pinaka nakita naming challenge namin sa Wagayway Equality at sa Batangas.
Thank you, Mr. Ivan. Thank you. Albion, you have anything? Like,
I love Miss Yan is raising her hand. Miss Yan, would you like to speak?
Thanks, Amy. So, sorry to cut you off, LL Ben. Sundan ko lang yung sinabi ni Ivan kanina regarding dun sa discrimination, especially sa amin, I'm speaking in behalf of the trans community, discrimination sa healthcare system. Kasi hindi lang within the cisgender tayo nakaka-experience ng discrimination, even within the community. And minsan sa healthcare system pa rin, na-experience pa natin to despite of the awareness campaign, education na binibigay natin sa mga healthcare providers. Nakakalungkot na, especially sa aming mga trans, na we have a set of special needs compared to other identities, especially in terms of gender affirming. So, ang dami pa rin naririnig tayo or nakukuha natin ng mga cases na nadi-discriminate ng mga trans individual pagpasok pa lang ng clinics or ng mga community centers all over the Philippines. So hopefully, with these types of activities and continuous learning process natin, not only within the community, but also let's all incorporate allies as well. Matanggal natin to. Yung discrimination, stigma and discrimination, not only with the community, the trans, but also the LGBT and also the HIV, stigma and discrimination. Sorry, nad ka lang. Thank you. The floor is now yours, Albion.
Oh, Mr. Ivan, raise your hand.
Last na siguro for the challenge, wala ding ready doon, even the government, even us, hindi ready sa mga ganitong klase na disturbances or surge. Kumbaga kaya tayo ay medyo nawindang, pero yun at least kung nung nagsama-sama naman at nagtulungan ay kinaya naman natin. So yun, back to you Clea.
Thank you, Mr. Ivan. And of course, Albion, yes.
Well, actually, what I have to input was already raised by Miss Yanyan, because as a trans woman, that is also something that I really see that we are struggling in the community. Kaya importante talaga na makonekta natin yung laban natin sa healthcare system with the political aspect of it as well. Na kung gusto nating mawala ang HIV and AIDS, we must also address na hindi lang i-extend yung efforts natin, but for our efforts, especially that coming from the government, to be approachable, for them to be SOGI sensitive para sila na mismo yung lalapitin ng masa. And
correct.
And with that, siguro we must build a atmosphere that is protective. Kung kaya that leads me to our next question. Siguro we can add some brief answer to it. Paano kaya natin maipaglalaban pa ang ating karapatan? Let's start with Ivan.
Yes, maipaglalaban natin yung karapatan natin lalo na ng mga key populations. Yung mga key populations natin kasi mas vulnerable sila sa sa human rights violation. Kumbaga mapapagdugtong lagi natin yung health rights ay human rights talaga. Number one ay una dapat alam natin ng key populations ano ba yung mga karapatan natin. So kasama ang part namin dito is TLF Share, yung human rights component ng Global Fund. May mga legal literacy training na kinakonduct din sa Batangas City, Batangas Province. Pangalawa ay maganda din alam natin kung kailan tayo or dapat talaga alam natin kung kailan tayo na-violate yung mga karapatan natin. At ang huli ay dapat alam natin kanino tayo lalapit. So sa ngayon, may care program din yung TLF at si Tony GI Care Officer. Yun, alam natin sino bukod sa care officer, sa sino pa yung pwede nating lapitan. Kasi ang usapin ng HIV ay hindi lang talaga health service. Kumbaga maganda nakikita natin yung lens ng sabihin na natin yung sa rights nga, may participation at enabling environment. Pati sa governance, malaking bahagi noon ay patuloy na yung pag-unpack baga ng mga experiences ng mga key populations. Makuha natin sa kanila ano ba yung pangangailangan nila at saan tayo pwede pang tumutok. Yun lang.
Thank you, Ivan. Of course, Tony.
Okay. Yeah, gusto ko lang din dugtungan yung sinabi ni Ivan na ang HIV, ito ay hindi lamang health issue, it is a human rights issue na dapat natin emphasize palagi. Paano natin may paglalaban ng ating karapatan pantao? I think sa akin yung personally dalawa, education and empowerment. Kailangan natin i-educate ang ating community kung ano ang kanilang mga karapatan pantao para aware sila kung yung mga karapatan pantao nila ay nilabag pa. Pwede ito nilabag ng estado o nilabag ng komunidad. Empowerment, dapat natin i-empower ang lahat ng mga biktima ng karahasan at pang-abuso ng karapatan pantao na dapat ipaglaban nila, tumayo. Kasi maraming batas nandyan, pero kapag hindi natin itong tines, ang ngipin, ang pangin ng batas, mawawala lang ito. Maraming kaso na nahawakan ang MOHER, it's well documented, pero mismo ang client ayaw i-push through ang kaso na yon. Kaya klaro na ito ay isang diskriminasyon. However, alam naman natin we are client-centered. So we respect the decision of our client. Kaya nga dapat na natin wakasan ang itsura, forma, at ang kultura ng ating community dito sa komunidad. Yan naman po. Maraming salamat.
Thank you, Tony. And of course, Yan.
Thanks, Clea. Hindi ko na alam kung anong idadagdag ko pa kasi sobrang ganda na ng sinabi na Ivan siya ni Tony, especially on education and empowerment. For everyone na lang din siguro for our community members who are experiencing discrimination and stigma, I guess it's very important for us to speak up and stand up for our rights, especially if naka-experience tayo ng ganitong mga cases. Like what Ivan said a while ago, there are organizations, we advocates, you can message us, lapit tayo, huwag tayo mahihiya na mag-reach out at sabay-sabay natin tong wakasan itong mga discrimination, especially on HIV and all of the things that we are experiencing within the community. Sadly, every day is a daily struggle for the community, di ba? Hindi lang sa usapin ng HIV, may iba pang mga stigma and discrimination tayo na experience. Pero always remember that tayo nandito sa event na ito, we advocates are here to help each and everyone. Ayun po.
Wonderfully spoken. Thank you, Yan. I guess here's what I've been hearing kasi a lot of talk about how our rights are being violated, how basic human equality is being violated either by the stigma brought on by being LGBTQIA+, or even having or living or having issues with HIV. And the conversation around HIV and the community. So I guess my next question will be, because this whole event is for hashtag HIV Free Pinas, ano yung idea or concept ninyo ng hashtag HIV Free Pinas? Maybe we can start with Sir Ivan.
Sige. Yung konsepto ko ng HIV Free Pinas ay dagdag ko din to sa kadugtong nung kaninang tanong. Maganda, bukod sa service delivery network na nakatutok sa HIV, alam ko meron na ding legal component, may mga iba na ding SDM na may legal services. Kumbaga maganda siya na may legal service delivery network for HIV services. Pangalawa ay yung HIV stigma-free Pinas. Kumbaga, kapag na-reduce natin yung barriers, ito yung hadlang para sa key affected populations natin to access yung health and rights services and other support services. Yun yung konsepto ko ng HIV Free Pinas.
Thank you, Sir Ivan. Maybe we can go to Ms. Yanyan.
Thanks, Clea. Sa akin naman, ang idea ko or concept ko of hashtag HIV Free Pinas is Pilipinas na one, katulad ng sinabi ni Ivan kanina, one free from stigma and discrimination, not only with HIV but with all the struggles that we are experiencing right now. Free access to healthcare system with holistic and responsive to the needs of the community. And lastly, HIV-free Pinas that is responsive not only to healthcare but also to other psychosocial services as well.
Thank you, Ms. Yanyan. And of course, Tony.
Yung sa akin, yung konsepto ko sa hashtag HIV Free Pilipinas, kung ang komunidad natin nakilahok at sumasama sa cause natin to fight the halt or the spread of HIV. Kung ang komunidad marunong na or took the challenge to break the silence and shame that surround HIV and AIDS at dinil na ito openly. Kung ang komunidad ina-address ng HIV ay ito ay hindi lamang problema ng mga advocates, hindi lamang problema ng Department of Health or ng Social Hygiene Clinic, or ito ay problema nating lahat. So yon, kung may awareness na at pagtanggap na ang HIV nandito na at parte na siya ng komunidad. Yun.
I love that. It's a problem of everyone. Hindi lang siya isang community. I love that. Thank you. Now, maybe before our guests, before we end this segment, maybe we can, Albion, we can ask them our question to complete the sentence.
Yes, of course. Grabe, napaka-comprehensive ng ating mga inputs today. Now, let's try to make it a little bit light, like just a concise answer to it. It's the same question that we have been asking earlier to our audience and earlier panel. Sa hashtag HIV Free Pinas, blank. You just have to complete the sentence. Sa hashtag HIV Free Pinas, blank. Miss Yan?
Hindi ako nakapag-prepare. So, for me, hashtag HIV Free Pinas. Sa HIV Free Pinas, lahat ay valid.
Beautiful. Sige, what about Tony G?
Okay. Sa hashtag HIV Free Pinas, ang batas ay patas.
I love. And of course, lastly, Mr. Ivan.
Yan sa akin sa HIV Free Pinas, gigising ang PLHIV at yung ibang key affected population nang hindi na natatakot o wala ng pangamba.
Thank you.
All right. Thank you for that very fruitful, very concise, and very striking inputs and answers to our questions. Now, we will be proceeding to our next segment. It is really such a great honor to be graced with your presence today to our guests. Thank you so much. Now, Now, Miss Clea, I would be asking you naman regarding, because we were asking #HIV Free Pinas to our guests. Now, what would have to say about it?
Ba na may batas tayo na nagproprotekta sa mga PLHIV community. Ano nga ba ang RA 11166 or the HIV and AIDS law?
Well, excited na akong malaman yan, Ms. Clea, and to gear us more into protecting and upholding the welfare of our constituents and community. At para samahan tayong pag-usapan ng RA 11166 o ang HIV and AIDS law, narito we have Ms. Mara Quesada, that is the Executive Director of Action for Health Initiatives Incorporated, or ACHIEVE. Good day, Ms. Mara.
Hi, Ms. Mara. Well, we're waiting for Ms. Mara, but Ms. Mara will be here to talk about, of course, the RA, the HIV and AIDS law, which is very important to the community. Hi, Ms. Mara. Welcome.
Hello. Hi, Clea. Hello, Albion. Did I pronounce that correctly?
Yes, Ms. Mara. Good
Hi.
day.
So I think, Ms. Mara, our first question is, like all the questions we've asked, like all the guests we've had earlier, we asked them, first, what is the advocacy of your organization?
Mm-hmm. So I come from an organization called Action for Health Initiatives, or ACHIEVE. We've been around, we've been around for about 21 years. We've been around for about 21 years. Our advocacy is really in terms of human rights, human rights and gender transformative approaches to a host of different issues, including HIV and AIDS, migration, and tuberculosis. And from there, we branch out to try to respond to the needs, articulated needs of the communities, including responding to HIV-related stigma and discrimination, which is one of our major programs. From capacitating stakeholders so that they understand what constitutes stigma and discrimination, to providing legal redress to our PLHIV community who experience discrimination because of their status.
Wow. Okay. So you respond to the needs, especially when it comes to discrimination. But I think one of the things that I hope we clarify for the people watching is, ano ba exactly ang RA 11166 or the HIV and AIDS law? What is it?
Yeah. So for those of you in the audience, for your information, the Philippines is actually the very first country in this region to come up with an AIDS law. That was the Republic Act 8504 back in 1998. So pioneer tayo dyan. And what was really a striking feature of that law was, as early as 1998, we already recognized HIV-related stigma and discrimination. And it was a key feature in our law, which stipulated na bawal talagang mag-discriminate on the basis of HIV status. But then 20 years later, the experience of working with communities affected by HIV, we found that the old law parang fell short in ensuring na nakakapag-respond talaga siya sa nagbabagong realidad ng HIV sa Pilipinas. And so, as early as 2009, we started engaging in the advocacy to amend RA 8504. And it took us 9 years. It took us 9 years to eventually, finally, come up with a new law, which is Republic Act 11166, or our Philippine HIV and AIDS Policy Act. The difference of the current law is that it's really more imbued with human rights. It's the first law, if I'm not mistaken, it's also the first law that we have in this country that already stipulates sexual orientation, gender identity, and expression. So may recognition siya doon pa lang sa ating declaration of policies. Meron na tayong recognition of the important factor of SOGI in terms of ensuring that our communities are able to access services, because it recognizes the fact that SOGI actually constitutes a basis for discrimination. No? And that's why we have these communities who are marginalized and are unable to safely access our services. In-expand rin dito sa batas na ito yung mga HIV-related services. So when it comes to HIV testing, for instance, we recognize that there are now different modes of HIV testing. Hindi na lang yung tulad dati na may screening test ka and then meron kang confirmatory test. Napagkatagal-tagal. Nawawala yung ating mga kliyente dahil umaabot ng 1 buwan or mahigit pa pag nasa probinsya ka before you get your HIV test results. Now we have rapid HIV diagnostic algorithm. Now the law has opened an environment that allows for new innovations. Kaya ang self-testing is also something we're starting to introduce in the country. I believe PLY is very much involved here. Pati dun sa ating HIV treatment, nag-expand na rin siya, no? From dati nakadepend lang talaga tayo doon sa ARVs for treatment. Now we know that there are ARVs for prevention as well. So PrEP and PEP, no, pre-exposure prophylaxis and post-exposure prophylaxis. And yung mga yung mga care services natin in-expand din, no, from simply medical and healthcare services, in-expand din natin yung socio-economic and psychosocial care services, not just for PLHIV, but also for their significant others and their children, for OFWs, and so on. We also expanded the coverage of breach of confidentiality to include individuals who nagchichismis lang, ganyan. Yung chichismis ng HIV status ng community. We've also included yung context ng social media as an avenue for disclosure of HIV status without consent, and we now have a more stringent penalty for HIV-related stigma and discrimination.
Right.
Hopefully, if this law were implemented the way we envisioned it to be, it would really be an avenue, a tool to create an enabling environment, no? A better and more inclusive environment for communities affected by HIV, making it easier for them to access services.
Yes. So thank you, Ms. Mara, for that extensive introduction and giving us an idea about what was changed with RA 11166 or the HIV/AIDS law to include and to protect as many people as possible. So thank you for that. Now, I think before we end this segment, because this has been one of the most this segment is all about the law and about how the law has expanded to protect more and more individuals in the community who are vulnerable. Before we end this, I think, like everyone, all the guests before us, we want to find out if you could complete the statement sa hashtag HIV-free Pinas blank.
Hashtag HIV-free Pinas.
Sa hashtag HIV-free Pinas blank.
Sa hashtag HIV-free Pinas, lahat ng tao ay pantay-pantay sa pagtamasa ng kanilang karapatan sa kalusugan.
Wow. Wow. Thank you. Beautifully spoken, Ms. Mara. Albion?
I love how comprehensive Ms. Mara's answers are. That in just one answer, she can hit onto most of our expected topics as well. So thank you for that very comprehensive and well-integrated answers to our to this RA 11166, Ms. Mara. Thank you so much.
It's been a pleasure. Thank you, Clea. Thank you, Alvin. And thank you to the audience.
Yes, thank you to everyone watching. And thank you, Ms. Mara. And so I think out of this entire program, talagang busog na busog ang ating isipan at puso. Ngayon, especially sa mga bagong kaalaman na binigay sa atin mula sa mga ating fellow advocates. Diba, Albion?
Exactly. Tamang-tama yan, Ms. Clea. It has been such a fruitful discussion at dahil 24 days na nga lang before Christmas, may mga pamaskong handog ang hashtag Let's, hashtag Aura Safely for a Healthy Pilipinas.
Yan, ready na ba kayo malaman ang regalo nila? Albion, reveal!
So I may pa-reveal because first we have category is inclusivity.
I love that. And category is pandemic response.
And of course, the category for Bida, Eleganza. Kaya mga beshies, here is the Bida sa Pag-aura, Magpabakuna. At para malaman natin ang bagong campaign ng #Let's #Aura Safely for a Healthy Pilipinas, here is Dr. Stella Flores to discuss it. Dr. Stella, by the way, is the Partnership Advocacy Policy Communications Unit Manager of Philippine Shell Foundation Incorporated, or the Protex Project.
Hi, good
Stella.
afternoon. Ang gaganda
Thank you
niyo
for-
naman, grabe.
Thank
Thank you,
Stella.
beautiful ladies. Yes, aside from HIV, we also have a current situation wherein we need to address, okay? So this newly formed partnership between Health Promotion Bureau and Philippine Shell Foundation aims to create integrated, inclusive, and targeted campaigns for HIV, but we need to include COVID-19. Our general objective for PIDA sa Pag-aura Magpabakuna is to make Res Bakuna more inclusive, create targeted and tailored messages to raise awareness on the gender-affirming hormonal therapy and antiretroviral therapy. And of course, we need to promote vaccine equity. Lahat po dapat ay nabakunahan. And to lessen the vaccine hesitancy because we will focus on the regional levels. We are using regional dialects to encourage everyone to get vaccinated. So what we did, we explored experiences of our medical providers in handling persons living with HIV and to our transgender women clients in the triage section of COVID-19 vaccination sites. We identified their concerns regarding COVID-19 mass vaccination, and then we determined the intersections among COVID-19 and their ARTs as well as their GAT. And with that, we were able to gather concepts, stories, narratives that serves as an inspiration in creating the campaign for COVID-19 vaccines. Of course, with consideration to their GATs and their ARTs. So here it is, our Bida sa Pag-aura, Magpabakuna. Bida ka pag ikaw ay magpapabakuna. That's our new campaign now. Thank you, ladies.
Thank you, Doc Stella.
Thank you
Thank you
so
so much. Now we're going to be, thank you, Doc Stella. And now we're going to be introducing Kel for the C19RM project. He is the C19RM project officer of Philippine Shell Foundation Incorporated Protex Project. Hi, Kel. Welcome.
Hi, Clea. Hi, Albion. Maraming
Hello.
salamat for the introduction and magandang hapon po muli sa lahat ng mga nanonood sa araw na ito. Muli po ako si Kel, the project officer mula sa Pilipinas Shell Foundation. And in addition lang sa sinabi ni Doc Stella a while ago, this collaborative effort between Department of Health and the PSFI or Pilipinas Shell Foundation is made possible by the support of the COVID-19 response mechanism, otherwise known as the C19RM. So ano nga ba ang C19RM, no? To mitigate the impact of the pandemic on people living with HIV and our key population, PSFI received additional funding from the Global Fund to support programs to support programs fighting HIV in the Philippines. So this is the COVID-19 response mechanism, or the C19RM. As we are all aware, the COVID-19 pandemic has unfortunately disrupted the HIV continuum of care. So kailangan talaga natin tugunan ang mga pangangailangan ng ating key population dahil sa challenges dulot ng pandemyang ito. So sa campaign na ito, maaari nating masagot ang mga katanungan ng mga PLHIV and transgender community tungkol sa pagpapabakuna, at layunin din ng campaign na ito na tudukan ang mga haka-haka at misinformation tungkol sa bakuna. And lastly, para sa mga nagdadalawang isip pang magpabakuna, this campaign would hopefully encourage them to get vaccinated for additional layer of protection, not only for them, but also for their loved ones. Thank you so much, po.
I love it. So thank you, Doc Stella, and of course, thank you to Sir Kel. Salamat
Thank
sa
you.
inyong trabaho to get people vaccinated. Kasi very important yan, especially during this pandemic. Thank you. Yan. So, At dahil madalas nakikita ang hashtag HIV Free Pinas sa mga HIV campaigns natin these days, dapat nating malaman kung ano nga ba ang inspiration nito, saan at paano nagsimula ito. So I just want to say thank you to Doc Stella and to Mr. Kel for being here to talk about the different program that you both are spearheading and really doing so that you can encourage people to get vaccinated. Diba, Albion?
Yes, thank you so much for such initiatives, for such campaigns, and we hope that more people will be reached out by these campaigns.
Thank you. So now that we want to know about hashtag HIV Free Pinas and the HIV campaign, we want to also understand the inspiration behind this. And so we're going to be inviting Ms. Kling Malaco from the Department of Health, Healthy Filipinas, to share the vision of hashtag HIV Free Pinas.
Materials, especially on HIV and AIDS. And this hashtag actually represents positivity while being aware and mindful of the current situation of HIV and the broader disposition of the PLHIV community, our beloved partners, because we always treat our key affected populations and our vulnerable groups as partners. They have to be part of the response. Kasama sa hashtag na ito ang naratibo o ang istorya ng ating mga key affected populations at vulnerable groups. Hence, the core concept of HIV Free Pinas communicates heart, it communicates hope, and it communicates a vision. So pinapakita nito kung saan tayo patutungo, diba? So in hashtag HIV Free Pinas, being free kasi does not literally mean just being free from HIV.
Yeah.
Okay, being free means being free from inequalities, being free from discrimination, being free from stigma, and all the possible socio-cultural, economic, and even political intersectionalities that affect our broader HIV response as a country. So ipinapalaban ng hashtag HIV Free Pinas ang pagkakapantay-pantay, yes to equality and end inequalities in HIV and AIDS response. So hashtag HIV Free Pinas in hindsight as a multi-sectoral campaign supports the UN Political Declaration and the Global AIDS Fast Track Framework to achieve zero new infections, zero discrimination, and zero AIDS-related death. So kapag tulong-tulong tayo, darating tayo dyan. So lastly, from both communication and public health perspectives, this campaign is a manifestation of what we have been wanting to achieve as a nation. HIV Free Pinas, right? So laging tandaan, boses, puso, karapatan, ito ang lagi nating tandaan kapag nakikita ang hashtag HIV Free Pinas. Let's breathe life into this campaign. So sa muli magandang hapon at sabay nating isabuhay ang hashtag HIV Free Pinas ngayon at magpakailanman. Thank you so much, Clay and Albie.
Thank you, Ms. Clay.
Thank you so much.
That was so beautifully said that this is a vision that we are creating, HIV Free Pinas. So it's something that we can work towards. And if we do that, we can also free ourselves from every other form of discrimination and stigma and create equality for everyone. Beautiful. Thank you, Ms. Kling. Albion?
And it is also beautiful that the campaign is really coming from the masses. It's multi-sectoral, so there is really a non-compromising aspect to it. And in our hopes for inclusivity, it is really vital for us to be non-compromising and to have our campaigns really taken from a bottom-to-up approach and then back to our constituency, to the masses as well. So thank you for that, Ms. Doc Kling, and to our guests today.
Yes, Doc Stella and Kel, thank you so much for what you shared today for this segment. Now, para pa rin sa ating hashtag ngayong hapon, complete the sentence sa hashtag HIV Free Pinas Black. I'm hoping that yung mga tao na nasa Zoom and who are watching us on Facebook, ilagay natin ang sagot sa comment section dito sa chat box ng Zoom, or maybe on Facebook, you could just type it and then so that para mabasa namin yung ng live ang inyong mga kasagutan. Yeah. So we're also inviting questions from the audience, especially the people who are here in the Zoom, or perhaps people who are people who are in the Zoom or who are watching on Facebook, if you have any questions for the speakers who have had their time to talk and who we interviewed earlier, if you have any questions for them, please feel free to ask them now. Diba, Albian?
Yes. Kung may mga palaisipan pa rin sa atin regarding the discussion, feel free to add it up as a question, as a comment, so that it can be answered by our guests. For our guests are really open to answering it. So let's be looking into our comment section now and the chat box if we have any questions already.
Sa mga nandito ngayon sa Zoom, if you have any questions or maybe perhaps filling up the statement sa hashtag HIV Free Pinas, please type it here in our chat box in Zoom din.
Ay, napakaraming viewers natin sa ngayon. May mga galing sa Tokok National High School. So, ayun, shout out sa ating viewers. Feel free to comment and we are just waiting for your questions.
Yes, we are. So for anyone watching, again, if you have any questions for any of our speakers today, please feel free to ask them because they are the experts and they have a lot of input and insight that they can offer anyone who's watching. And yeah. Well, for one question, I guess one question that there's I think one question that I have we have is for the RA law, for the RA 11166, paano ba natin ipaglalaban ang karapatan na nakalagay doon sa RA 11166? Maybe Ms. Mara can be the one to answer this.
Okay.
How do we enforce and implement this law in reality?
I hope you don't mind. I don't
Yes,
turn on
Ms. Mara.
the video. That's a really important question, no? And I'm glad somebody asked that because laws are really not they're not useful unless we invoke them. So ang ibig sabihin nun ay andyan lang yung batas, nasa sa atin kung gagamitin natin siya. So paano natin may paglalaban yung mga karapatan natin na pinoprotektahan ng batas? Magagawa lang natin yan kapag ginamit natin siya kapag may nakaranas ng violations, no? So one way of actually using the law to promote, protect the rights of people, and mind you, not just people living with HIV, even people who are not yet infected with HIV are also protected by this law. Yeah. So kapag tayo nakaranas ng diskriminasyon, kapag may nagsiwalat ng ating HIV status nang wala tayong pahintulot, kapag tayo ay hinaharas ng law enforcement, habang tayo ay nag-deliver ng HIV services, gamitin po natin yung batas. No? Lumapit tayo sa mga maaaring magbigay ng assistance sa atin kung paano mag-pursue ng kaso, no? Tungkol dito. Pangalawa, the law also provides a host of programs and services. Singilin po natin ang ating singilin natin ang stakeholders doon sa mga mandato nila pagdating sa batas. No? So the law says the Department of Education, for instance, is required to ensure that HIV education is integrated in our learning institutions. Nakalagay po sa batas na ang ating Department of Labor and Employment needs to ensure that workers and employees are provided with HIV information and are protected from HIV-related discrimination in the workplace. And so on and so forth, no? That the DOH is supposed to make sure that HIV treatment...
Hey, excuse me, I have a question.
Sorry? Yes.
I have a question.
Go ahead.
Can you start over? I'm late.
Sorry. Sige, I guess we'll just get to that question later. Maybe Ms. Mara will just continue first. Yes, go Ms. Mara.
Yeah. The law also says that the Department of Health needs to make sure that everyone has access to...
Yes, Ms. Mara?
let's get to the question later. So I was saying pre-HIV.
It's kind of urgent though.
To everyone who have been diagnosed with HIV. So the law has all these
well, I have HIV, and I just wanted to ask a question about it.
Okay, can you? It is okay for you to hold on to that question. Let me just finish. I'm about to end my statement, and then we'll go to your question. Is that okay? Okay.
Yes, that's fine. Thank you.
All right. Thank you. Yeah.
Okay. So, in short, magandang alam natin yung laman ng batas para alam natin kung ano-ano yung mga provision ang makakatulong sa atin, ano-ano yung mga, sino-sino yung mga inatasan ng batas na may mandato para ipatupad ang mga programa at serbisyo para dito. Alamin rin natin yung mga karapatan natin para kapag ito ay na-violate, alam natin na may magagawa yung batas. And for those of you who need information or education about the law, let us know. This is something that we provide as a service to the community and our partners, both in CSOs, among the civil society, as well as government. So we are in Facebook. Nag-plug bigla. Okay lang ba yun? We're in Facebook. You can reach us through our Facebook page, Achieve Incorporated.
Thank you, Ms. Mara. So gamitin ang batas. Kailangan gamitin siya para maging effective, right? It's there. Use it. Thank you. Now, we have another question. The question is, how did the COVID pandemic impact on HIV or AIDS epidemic? And did we see an increase? And what could be the cause? And were there also problems of accessibility in medicine because of lockdowns? Maybe we can call on Doc Stella or Doc Lloyd.
I'm sorry, but I thought we were opening the questions for the audience.
Oh yes, this is another question that was given to us earlier. So we're just
okay.
We're queuing all the questions so that every question that came to us first, we are going to ask that first. Thank you. Right? Is that okay with you? All right. So maybe we can ask Doc Stella or Doc Lloyd about that question. Again, the question is, how did the COVID pandemic impact on HIV or AIDS epidemic? And did we see an increase? And what could be the cause? And were there problems of accessibility in terms of medicine because of lockdowns? So maybe Doc Lloyd or Doc Stella.
Or Doc Lloyd, our program manager for Project Protects. If you're here, would you like to answer?
Well, let me answer. Yeah,
Ms. Marvy, our Deputy Executive Director, would like to answer. Please.
Okay.
Yes, Ms. Marvy.
Yes, definitely there was an impact of COVID on the epidemic of HIV. There was a lot of social hygiene clinics and treatment hubs that were closed because of the restrictions, and therefore the PLHIVs were not able to access their medicine and other treatment, and people were not able to get themselves tested.
Right.
So there was a distinct drop in the number of testing that was done, and we're hoping to do this. And this is why there was an adaptive plan created by the Department of Health, NASPCP, called TED.
Right.
For the testing, we now have differentiated service delivery. For example, we have now you have risky behavior and you feel that you cannot go to the testing sites. You can check with Aura safely and figure out how to get the self-testing kits. And we will teach you how to do the testing, and if whatever the results will be, if it's reactive, then we help you get through the treatment. And if it's negative, then we will help you get through remaining negative. Now we already have PrEP and PrEP prophylaxis that actually help those that are negative but are still in a risky situation. For example, those that have partners that are PLHIV who may need to be protected because of their situation. So there's a lot of new innovative ways of working with the PLHIVs and the key affected population, even in spite of this pandemic. Over.
Yes, thank you. Thank you for answering that that there are many ways that we're trying to reach key affected populations despite the pandemic and despite the difficulty reaching them or getting them tested. Thank you.
Great, thank you. Thank you for that, speakers. Ms. Clay, actually, we have another question here in the chat box. It was sent stating that just want to ask if the home testing kit available now in the Philippines. If not available yet, where can we refer the suspect to get tested that is free?
Right.
So anyone from our guests who would like to answer the question?
I just said that the self-testing kits are available and they're for free. Please log on to the Aura Safely and check how to get it. Actually, the TLY is also our partner.
Yes,
and the TLY has been providing the self-test kits also. So we have already delivered a lot of self-testing kits to these organizations who will help us promote the self-testing kits. Over.
Yes.
Yes. Clea, they can also access the Aura Safely. We are present at 3 social media accounts, the Facebook, Twitter, and Instagram. And if they wanted to inquire where to access the services, feel free to get in touch with our online beshies. These are our trained field staff or online beshies who will be able to address their needs. Thank you.
Thank you, Doc Stella and Miss Marvy. I just want to say I have friends who have availed of the free HIV testing home kits, and super duper, it's been helpful for them and a relief knowing that they can get tested in the convenience of their home and they can know their results really quickly. Albion?
Well, thank you for that. And we are really assured na may mapupuntahan tayo. So for those, again, who would like to access to these testings, just reach out to Aura Safely in all of their socials.
Right.
And of course,
hey, I actually have to take a really big shit.
All right.
I have to poop really badly. Excuse me.
All right. So I think we're just having some interference when it comes to this live. But I just want to say that to everyone watching, again, we try to create safe spaces for everyone. And
wait, so does everyone here have like HIV?
And we are hoping that
is this a safe space? Because I have HIV.
This space is honored, and that people who are that everyone here honors each other's stories. So so everyone who's watching, I just want to say thank you for being with us on this show. And mga beshies, maraming salamat sa pagsama sa amin ngayong hapon. This is just the start of our 12 days of HIV awareness campaign. Diba, Albion? So,
well, do we have like a last question? Siguro we can raise it naman properly. So if you have questions, kindly raise your hand first, your virtual hand, then maybe any of our guests can answer it. Let's just try to, of course, raise it in a proper manner.
Right. Okay.
So last call for questions. All right. So there being none, bago tayo magtapos ngayong hapon, pakinggan muna natin ang Pilipinas Shell Foundation Deputy Executive Director and Director for Externally Funded Programs, Ms. Marvy Trudeau, for her closing remarks.
Sorry, I am on mute. Okay, good afternoon again. And thank you again, Clea and Albion, for the wonderful hosting. I also would like to thank all of those that started to, that were part of the panelists. So good afternoon, everyone. So, in behalf of the team of the Shell Foundation, I hope that you're all safe and healthy. As our country observes the World AIDS Day today, and as part of Healthy Filipinas, and Aura Safely kick-off activity of its 12 Days of HIV Awareness campaign, I would like to express my gratitude to all those who are participating in this afternoon session. Philippine Shell Foundation supports the Department of Health and all other partners in the mandate of the World AIDS Day, which commemorates the difficulties and victories of the battles against HIV and AIDS. I would like to thank this opportunity to invite everybody to join the upcoming activities of 12 Days HIV Awareness. This 12-day event will focus on issues relevant to the wide theme of this year, ending the epidemic, equitable access, everyone's voice. To put it simply, equitable access refers to the notion that every individual should have fair and equal access, regardless of socioeconomic or HIV status. But with the advent of COVID-19 pandemic, it contributed to the declining social and economic conditions. To get AIDS response back on track, we must prioritize those who need it the most. Social inequities that put people at risk of developing HIV must be addressed. And we also need to fight for our right to health. We at Philippine Shell Foundation strongly believe that through our solidarity and shared responsibility, it will be possible to end HIV epidemic and ensure that everyone has equitable access and right of good health. Okay. One second, I lost.